Welcome to the continuing series of South Florida Hospital News Leadership Conversations. Today we have the honor, and I do mean it an honor, a good friend of mine for healthcare since I really started in the business 20 years ago, Aurelio Fernandez. Aurelio was with Memorial Healthcare, as some people may know, the South Broward Hospital District. So welcome, Aurelio. Welcome to our conversation. Tell us, today, your position with Memorial, which I know is coming to an end of contract-wise, and you're retiring out of the business. But tell us where you are today.
Well, today we are interviewing for a successor. We have 4 candidates. It has been a very good selection. We believe that any of the candidates can take this organization to the next level. I will miss the staff. I believe we have an executive team, and that is an all-star team, and that has helped us elevate the number of services that we provide, the financial position of the organization. It has been a true honor to lead this organization for the last 6 years.
Tell us a little bit about your family and family background, your wife, your kids.
I grew up here in South Florida, in Miami, a Cuban immigrant in 1961. My wife was born here in Miami, and we met in high school. We've been married 47 years. We have 4 children, 4 adult children. So they're in their 40s and 30s. We are the grandparents of 2 girls and 2 boys that we're going to enjoy a lot once I have more time to spend with them. It has been a real wonderful family life that I will cherish forever. And the fact that all my sons are here in South Florida, as a matter of fact, they're all in Broward County, helps us in staying together and growing up in a family environment that a lot of folks don't have the privilege to do when their sons and daughters move away and they're not close to the house. So I'm looking forward to it, and it has just been a great family journey.
Tell us a little bit when you got started a career or started thinking about a career, kind of educational background that got you to where you are today.
I got into healthcare by coincidence. I was looking for a job in 1976. My background is finance. I was an accountant, and there was an opening at Palmetto General Hospital in Hialeah for a chief accountant. I applied and I got the job. I did sit for the CPA exam. I became a CPA. And from there, I went to what today is called Tenet. Back then in the 80s, late 80s, it was called American Medical International, AMI. And did that for a couple of years as the chief operating officer. From there, I was recruited back to Palmetto General as the CEO of a physician partnership. From there, I went to Florida Medical Center. Florida Medical Center was a little bit more challenging than Hialeah Hospital for a variety of reasons. And I made a decision that I needed to get out from the for-profit environment. By coincidence, again, there was an opportunity here at Memorial. And there was an opening at Memorial Hospital Miramar, which was a hospital that had just opened a year earlier. And I knew the market. I knew the North Miami-Dade market. The Memorial Healthcare System did not have a chief operating officer. So Frank Sacco promoted me to the executive vice president and chief operating officer. And when Frank retired back in 2016, I threw my name in the hat. And fortunately, the board of commissioners decided to stay from within, and I became the CEO, and it's been a wonderful journey. I couldn't be prouder of the team that we have and the employees and the level of commitment to our patients and the community to do what's right for the patient. And I'll share that later on when the pandemic hit, because we just outperformed and really delivered the best possible care during the pandemic.
What are maybe a couple of the challenges that you saw during your movement from the very beginning of healthcare to where you are today that you could kind of explain and maybe tell people how it helped you or things you would do or wouldn't do again?
When I was at one of the facilities in Broward County for Tenet, and the facility, Florida Medical Center, had a full spectrum of services that gradually they started doing away with because the demographics had changed drastically from a predominantly Medicare population back in the 70s and 80s to a predominantly younger population, childbearing age, not needing cardiac, and a variety of services that the hospital started with. So here I am in a hospital that did the first open heart surgery in Broward County, did the first catheterization in Broward County, and our number of heart cases was going down. They had shifted their service lines from cardiac and oncology into bariatric surgery. That was a hot ticket back in 2004 and 5, until the managed care plans decided not to pay for it and tell the consumer or the membership, you have to wait 2 years and see if you can do it by dieting and other means, exercising and all that stuff. So here you have two main product lines for this hospital that are not working as designed. And it was a very challenging 4 years for me because, as I said earlier, you have to deliver quarterly earnings. Then we have a psych unit, and that psych unit was not ran the way it should have been run according to Baker Act regulations. And it was a very low point in my career because they closed the unit for 45 days because the staff was inappropriately admitting patients as far as bypassing other hospitals that had emergency departments.
What does your day, or did your day look like in the most active mode? And we'll go into, and we can actually, we'll go into the COVID situation next. But what does a typical day of a CEO, not of a hospital, but a healthcare system look like?
Yeah. Well, you look at a lot of data, a lot of numbers. When our corporate offices were across Memorial Regional Hospital, I was able to walk the hallways like I used to when you're the CEO. When you're the CEO of a hospital, you have to walk the hallways. You got to get out of the office and know your staff. So we moved our corporate office from across regional to 2.5 miles away. So we became more detached. But we conduct a lot of meetings as far as, besides the executive committee meeting that we have every Tuesday at 9 o'clock, we do have scheduled meetings at each one of the hospitals. And I would definitely every quarter make it a point to have those meetings from my perspective with those A teams at their facilities instead of having them come here. That way, at least you have a sense of what's going on on the campus. Walk around the halls and talk to the staff. There will be at least 3 town hall meetings at every one of our hospitals. Even if not a hospital, for example, our business office, which is remote, our IT office, which is remote, I would go out there twice a year and tell our story in addition to hearing from the staff as to what are the concerns or challenges, if I may.
During your career, who were maybe 1 or 2 of the top people that you could say, or if you don't want to say, just, at what point in time, who they were and why they made a difference in your career?
I think the one that influenced me the most was Dr. Elliot Berg. Dr. Elliot Berg was the founder of Palmetto General Hospital back in the 70s. He was a thoracic surgeon, but a businessman. And he taught me how to be patient, not to embark on projects until you finish the project before, not to bite off more than you can chew, to surround yourself with people more talented. And he's the one that changed my path from finance into management. And I became the chief operating officer for that entity that Dr. Pierce owned through him because of my financial background. And now I started learning the management of hospitals by having 3 hospitals at the time.
What is a good piece of advice or a couple pieces of advice that you can give them as they pursue healthcare and pursue your job? Looking forward to doing that. What would you say to them? Well,
there's no question you have to work very hard. These folks who think they can get up the ladder working 8 to 5, it is not going to happen. You have to, I hate to say it because everybody talks about quality of life or a balance of life balance. you really have to put in the time and effort and energy, having late meetings at night while some folks are at home with the families. I gave all that up. I have a very understanding wife who understood that she would take care of the house and the kids, and I was out there in the workforce. Dedication, integrity. You do not have to step over people to get to this job. On the contrary, what you want to do is you want to mentor people that embrace the values that you have, and that is putting the patient first, quality of care. It's not all the economics. The money will always come.
What kind of kept that mind working and those trying to get to sleep at night kind of kept you up? What were one of the couple things that did that?
Not having the PPEs that we needed, and we're going international now to find gowns and to find masks, and then you buy the mask, and the mask is not the N95 mask, is not the small one, but it's the medium one, and it's unsafe. And then knowing that the price of these supplies are going through the roof. The first time around in 2020, we had adequate staffing, but by 2021, that staff had gone. And then where do you find these individuals? And now you're paying $180, $175 an hour instead of whatever the range is that you pay nurses. To me, that would keep me up at night. But by running in the morning, I was able to decompress and assess. But I had a lot of sleepless nights, Charles. I'll be quite honest with you.
I know in a couple of weeks, or depending, maybe a little bit longer than that, the chair you're sitting in today will be moved to somebody else, and they also will have sleepless nights, as one might say, because there will be problems out there that healthcare has to face time and time again. But with that, I am sure we will keep in touch, even when all this kind of shakes out in the next couple of weeks. We'll know who I think the new person is going to be sitting in that chair. So anyway, I want to thank you for this, and I look forward and have a great life after healthcare.